what if you could reverse kidney disease, optimize your cardiovascular fitness, feel great, look great, and get rid of all the symptoms that you're having of the swelling, the puffy face, the lack of hydration, the feeling of thirst all the time, the frequent urination? What if you could do that without medication, without surgery, and without putting yourself at risk of an organ transplant? Well, in this video, I'm going to show you 3 simple ways that you can do that. I'm Reagan Archibald. I'm a functional medicine practitioner. I'm a peptide expert, and I've worked with over 60,000 patients in helping them reclaim their health through novel structures called peptides. Now, if you haven't heard of peptides, a lot of you may be thinking, I take collagen peptides and they're great, and those are great, but these peptides are sequences of proteins that allow your cells to start expressing new mechanisms of health. And so what peptides can do is turn on those pathways in your kidneys so that your kidneys can actually start functioning better. So one of my teachers, 20 years ago, used the analogy of imagining your garage door only opens a little bit, but yet you have to get the garbage out of the garage door. Well, pretty soon the garbage is going to start accumulating and the toxic waste won't be able to get removed. Now, that's what happens in our kidneys as we drink, water that's contaminated. And yes, if you go to the ewg.org, you can see that there might be issues in your water supply. As we consume plants that have organic pesticides or waste materials on them, those things start to back up our kidneys. And then probably the biggest thing is stress. And I know many of you are in a modern society where we're pushing ourselves constantly. We're forgetting to drink our fluids, and this is putting an ultra heavy burden on our kidneys, not to mention the fast food, the processed foods, the junk food that gets thrown at us and we eat it subconsciously. All those things have an impact on your kidneys. And what we've discovered is there's 3 simple ways that you can unlock the power of your kidneys to start removing the waste again so that you can get on with your life. So the first thing is your kidneys aren't isolated. And so what I mean by that is, how many of you know somebody who has experienced what's called death by neglect? They haven't taken care of their health and they've died sooner than what they should. So they isolate themselves and they forget to look at all the damage that's going on around them. So one of the things that we've discovered is your kidneys need support. And so one of the major things that we do with everybody who comes to work with us is we run functional blood chemistry panels so that we can see where the damage has occurred in your kidneys. And by looking at the other pathways around the kidneys, like your liver is a big one, your cardiovascular system, your white blood cells, your gut markers, all of those markers actually help either assist the kidneys or detract from it. Most doctors are just looking at your kidney function, GFR, they're looking at creatinine levels, and they're failing to look at the whole picture. And so the first thing that you've got to realize is your kidneys aren't isolated. No death by neglect means don't leave any stone unturned when it comes to getting the right tests. The second thing that we've uncovered is there's very specialized treatments that can allow your kidneys to start functioning better. One of the great things that we've discovered about the use of these novel peptides is they're very easy to utilize because of the way that they communicate with the body. They're naturally excreted in your body, and so they're not overriding a system. Sometimes if you're on a diuretic or even a hypertensive medication, those things can start to put a burden on our kidneys. Now, peptides are a way of reversing some of the damage without putting you at risk. And so, first thing we've discovered is the kidneys aren't isolated. So look at all the systems around them, the gut, the liver, the cardiovascular, the immune system. All these have an interconnected way of assisting your kidneys. Second thing we've learned is there's treatments that are very safe, very effective in the form of peptides and different protein molecules, even human cellular tissue products. Those can really help assist your kidney health along with the right nutrition. And then the third thing is get rid of the ibuprofen, the non-steroidal anti-inflammatory drugs. A lot of us don't realize this, but you can walk in almost any store and at eye level, you're going to see ibuprofen there. You got a headache, take some ibuprofen. Well, what some of the research shows is that the ibuprofen can actually start to damage the filtration system in our kidneys. I have a great friend of mine who runs 7 dialysis centers. And one of the big pieces of advice he's given me for years is he said, get all of your patients off ibuprofen. I don't want to see them in my clinic, so get them off ibuprofen. And so today, I'm proud to report back to Dr. Leach that we've been able to get thousands of patients off ibuprofen, get rid of their pain. So make sure that you get rid of pain, you get your body super healthy, and that's what's going to lead to greater kidney health. Now, I've got a whole video that explains this in better detail. It shows you a step-by-step process, and it's something you can click on here as you hit the button on the bottom. We'll take you over to the longer version of this. I look forward to seeing you on that video. Thanks so much for watching.